In this video, you will learn about 10 critical mistakes people make with ginger, without even realizing that these mistakes can put their lives at serious risk. Although ginger is known as a natural remedy, it can become dangerous when used incorrectly. From internal bleeding to heart attacks, the risks are real. Watch until the end to avoid potentially irreversible consequences. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Mistake number 1, consuming ginger when you have a high temperature or fever. When a person gets sick, especially during the colder months, they often try to strengthen their immune system by any means available. Ginger seems like the perfect ally. It warms the body, has anti-inflammatory properties, and helps relieve coughing. That is why many people prepare ginger infusions or add fresh ginger root to tea at the first signs of a cold. However, as soon as the body temperature begins to rise above the normal range, the situation changes dramatically. Ginger has a warming effect. It increases blood circulation and dilates blood vessels, which leads to an even higher body temperature. This can be beneficial in cases of chills or mild hypothermia, but when someone has a fever, it places extra stress on the body. When body temperature reaches 38 to 39 degrees Celsius, which is 100.4 to 102.2 degrees Fahrenheit, the body is already working at full capacity. The immune system is actively fighting off a virus or bacteria. The heart is beating faster and breathing becomes more rapid. Adding ginger at this point accelerates all of these processes, sometimes to a critical level. This can lead to tachycardia, which is an abnormally fast heartbeat, as well as seizures, headaches, and intensified inflammation. In people with cardiovascular problems, it can even trigger a stroke. That is why doctors strongly advise against consuming ginger when the temperature is above 37.5 degrees Celsius, which is 99.5 degrees Fahrenheit. During these times, it is better to use treatments that help reduce fever and avoid overstimulating the body. Mistake number 2, using low-quality ginger powder. Ginger is a popular spice, especially in countries that actively export seasonings. This demand has led to an influx of cheap powders on the market, many of which do not undergo proper quality control. It is common to find bags with no labeling, no production date, and no indication of the country of origin. Some containers are sold at very low prices and have an unclear list of ingredients. These products can not only be ineffective, but also potentially harmful. What makes them dangerous? First, these powders are often adulterated. Starch, flour, or even gypsum may be added to increase volume. Second, when ginger is dried or stored incorrectly, microscopic mold can grow, releasing mycotoxins, which are substances that damage the liver and weaken the immune system. Some batches are contaminated with heavy metals such as mercury, lead, and cadmium. These toxins accumulate in the body and gradually damage the kidneys, liver, and central nervous system. Children, pregnant women, and older adults are especially vulnerable. Pesticide residues are another serious concern. These are chemicals used during ginger cultivation, and their levels can exceed safe limits by dozens of times. In countries with low regulatory standards, this is a common issue. That is why, if you choose to consume ginger in powdered form, you should select only certified products in sealed packaging from a reputable manufacturer. Never buy ground ginger sold by weight, especially at markets or in spice shops with unknown sources. Mistake number 3, combining ginger with garlic. At first glance, this may seem like an almost perfect combination. Both ginger and garlic have been used in traditional medicine for centuries to strengthen the immune system, cleanse blood vessels, and fight inflammation and infections. They are often added to smoothies, salads, or tea, especially during cold and flu season. But behind this seemingly beneficial pairing lies a highly dangerous biochemical reaction. Both of these ingredients contain active compounds that affect blood viscosity. Garlic is rich in allicin, while ginger contains gingerol. Each of them on its own can thin the blood and help prevent the formation of blood clots. However, when combined, especially in raw or concentrated form, their effects are significantly amplified. This can lead to a critical reduction in blood clotting ability. Why is this dangerous? Even a minor bump can result in a large bruise. A nosebleed may not stop, and a small sore on the mucous membrane can lead to internal blood loss. The consequences are especially serious for people who are already taking blood-thinning medications, such as aspirin, warfarin, heparin, or clopidogrel. In such cases, severe internal bleeding can occur, including hemorrhages in the stomach, intestines, or even the brain. There have been cases in medical practice where patients were admitted to intensive care after drinking homemade, health-boosting cocktails with ginger and garlic for several weeks while undergoing anticoagulant therapy. According to the Journal of Herbal Pharmacotherapy, one such case occurred in an American hospital where this combination led to acute intracranial hemorrhage in a 62-year-old man. Mistake number 4, consuming ginger when you have high blood pressure. In recent years, ginger has often been mentioned as a remedy for stabilizing blood pressure, and there is some truth to that. It improves microcirculation, dilates blood vessels, helps relieve spasms, and can slightly lower blood pressure. But the problem begins when someone who is already taking antihypertensive medications decides to strengthen the effect by drinking ginger tea. Ginger does not just lower blood pressure, it enhances the effects of many medications, especially calcium channel blockers, angiotensin-converting enzyme inhibitors, and diuretics. As a result, blood pressure may drop suddenly. This condition is known as a hypotensive crisis. A person may feel sudden weakness, dizziness, cold sweat, may lose consciousness, and even suffer injury from falling. This is particularly dangerous for older adults. Their blood vessels are already less elastic, and when blood pressure drops abruptly, the brain does not receive enough blood. The consequences may include an ischemic stroke, impaired cerebral circulation, or even temporary memory loss. What makes this even more frustrating is that a person may not even associate the decline in their condition with ginger, thinking they just had a cup of a natural drink. That is why, in cases of hypertension, ginger should only be consumed under medical supervision, in minimal doses, and never in combination with prescribed medications. Mistake number 5, consuming ginger on an empty stomach. It is morning. You wake up, turn on the kettle, and decide to start your day in a healthy way with a cup of hot ginger tea. And then it begins. A burning sensation in your stomach, unpleasant belching, and the feeling that you have been burned from the inside. Why does this happen? Ginger stimulates the secretion of gastric juice. If there is food in the stomach, the acid has something to digest. But if the stomach is empty, the acid begins to irritate the stomach lining. This is especially dangerous for people who already have issues such as gastritis, high acidity, or ulcers. Regularly consuming ginger on an empty stomach can lead to erosion of the mucus lining, chronic inflammation, and even the development of open ulcers. Even if you are completely healthy, it is not worth testing the limits of your digestive system. Often, the symptoms do not appear right away. But after 1 or 2 months of daily health-boosting morning routines, you may start to feel heaviness, nausea, and belching. Moreover, with prolonged use of ginger on an empty stomach, acid reflux may occur, where stomach acid flows back into the esophagus. This causes heartburn and inflammation. It is not just unpleasant, it is a direct path to chronic gastrointestinal problems. That is why if you want to drink ginger tea, you should wait at least 20 to 30 minutes after a light breakfast. Mistake number 6, consuming ginger before bedtime. You might be surprised, but ginger acts as a natural energy booster. It improves blood circulation, speeds up metabolism, increases alertness, and even slightly stimulates the nervous system. That is why it works so well in the morning. It wakes you up and activates internal processes. But in the evening, it becomes a problem. If you drink a ginger beverage 1 or 2 hours before bed, your body begins to rev up. Your heart starts beating faster, you feel slightly energized, and your body warms up. Even though you may be physically tired, your brain stays active, as if the day is just starting. As a result, you toss and turn, cannot fall asleep, feel irritated or anxious, and end up with a light, restless night's sleep. This is especially concerning for people who struggle with insomnia, heightened anxiety, panic attacks, or chronic fatigue. Neurologists emphasize that even natural stimulants like ginger can significantly disrupt the deep sleep phase. If you want to get a good night's rest, your last intake of ginger should be no later than lunchtime. In the evening, it is better to choose calming herbs such as chamomile, lemon balm, or lavender. Mistake number 7, consuming ginger when you have gallstone disease. Gallstone disease is a condition in which solid deposits, commonly known as stones, form in the gallbladder. These stones can remain unnoticed for a long time until something triggers their movement, and this is where ginger can become extremely dangerous. One of the effects of ginger is that it stimulates the production and flow of bile. In a healthy person, this improves digestion. But if there is even one small stone in the gallbladder, the increased flow of bile can literally push it out of place. If that stone blocks the bile duct, it causes intense pain, spasms, vomiting, and a rise in body temperature. The skin may turn yellow, and the person's overall condition can deteriorate rapidly. In such a case, emergency hospitalization is required. Patients are often admitted with a diagnosis of gallstone flare-up or obstructive jaundice. Sometimes the situation leads to urgent surgery, cholecystectomy, which is the removal of the gallbladder. It is important to understand that a person might not even know they have gallstones, and just 1 cup of ginger tea after a meal can suddenly lead to an ambulance ride, intravenous infusions, and surgery. That is why anyone who even suspects they might have gallstones should not stimulate bile flow with ginger, artichokes, oils, lemon, or any other choleretic products. A gastroenterologist will confirm this rule without hesitation. Mistake number 8. Consuming ginger before or immediately after surgery. Ginger has a pronounced anticoagulant effect. In other words, it thins the blood. This can be beneficial for preventing blood clots in healthy individuals. But in the context of surgery, this property becomes extremely dangerous. When a person regularly consumes ginger, whether in the form of tea, as a food additive, or in capsules, their blood becomes less viscous. If this coincides with a surgical procedure, a serious risk arises. During the operation, the blood may not clot properly, and the patient can begin to lose a significant amount of blood. On the operating table, this leads to complications, makes the surgeon's job more difficult, prolongs the duration of the procedure, and increases the likelihood of a fatal outcome. But the danger does not end after the final stitch. In the post-operative period, especially during the first 2 to 3 days, these patients are more likely to experience internal bleeding, hematomas, delayed tissue healing, and slow recovery of surgical wounds. Many patients, unaware of this risk, continue to drink ginger tea even after surgery, believing it to be a harmless, restorative drink. But this can lead to renewed bleeding from the surgical site or even internal collapse. That is why surgeons around the world recommend completely eliminating ginger from the diet 10 to 14 days before surgery and not consuming it for at least 7 days afterward. This applies to scheduled surgeries, dental procedures, mole removals, cosmetic surgery, and even cesarean sections. Mistake number 9, combining ginger with alcohol. In the world of cocktails, there is an entire category of drinks that include ginger, from ginger ale to mixes with rum or whiskey. People mistakenly believe that adding a healthy ingredient like ginger to alcohol somehow reduces the harm. In reality, this is one of the most dangerous combinations. Alcohol on its own dilates blood vessels, puts stress on the liver, and disrupts body temperature regulation. Ginger does the same. It increases blood flow, raises heat output, and stimulates the cardiovascular system. Together, they create a double impact effect. First, blood pressure can either drop or spike sharply. A person may experience dizziness, hot flashes, sweating, and instability. Second, the risk of cardiac arrhythmia and impaired cerebral circulation increases, especially in individuals over 40 years old or those with vascular problems. In addition, both substances are metabolized by the liver. When consumed together, the strain on the liver increases several times over. This can lead to flare-ups of chronic liver conditions, toxic reactions, and even poisoning. According to reports from the United States, combining alcohol with concentrated ginger extract often results in hospitalization, particularly among people who consume this therapeutic mixture on an empty stomach. This is especially dangerous for women with low body weight and fragile vascular systems. Mistake number 10, consuming ginger by older adults with chronic illnesses. After the age of 60 to 65, metabolism slows down, organs no longer function as steadily as they once did, and any interference with the body's systems can lead to unpredictable consequences. Although ginger is considered natural and beneficial, its effects on older adults can be too intense. Many people at this age already suffer from high blood pressure, diabetes, gastrointestinal conditions, or cardiovascular disorders. Ginger affects all of these systems at once. It can cause a sudden drop in blood pressure, lead to a rapid heartbeat, stimulate bowel movements, or, on the contrary, trigger intestinal spasms. Even more concerning is its ability to interact with medications. For example, in a person taking drugs to lower blood pressure, ginger can intensify the effects of those medications, resulting in hypotension. For someone with diabetes, it can further lower blood sugar levels, potentially causing a hypoglycemic episode. In addition, the liver in older individuals is less efficient at processing active substances. Even a small amount of ginger can accumulate in the body and intensify side effects. That is why older adults are strongly advised not to begin consuming ginger without consulting a doctor. And if it is introduced into the diet, it should only be in minimal amounts, with careful monitoring of overall well-being and bodily reactions. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.